Cannabis Smoke TV.
Cannabis and breast cancer explained. Hello there and welcome to Cannabis Smoke TV. Don't forget to like, subscribe, and share. There may not be conclusive clinical studies to prove that cannabis can cure breast cancer, but some people with the disease say it helps them cope with symptoms and side effects of treatment. If you're curious about using cannabis to manage the side effects of breast cancer, it's essential to consider the potential risks and benefits before dabbling in this alternative medicine. Consulting your doctor is an important step, but it wouldn't hurt to do some research independently. While cannabis is not a substitute for approved cancer therapies, anecdotal evidence from breast cancer patients shows that many consider it a helpful addition to their treatment. Here are some important things to consider if you're curious about using cannabis to cope with breast cancer. How can cannabis help manage breast cancer symptoms? Though there is little research to suggest that cannabis is an effective treatment for cancer, some people with breast cancer report that they found it helpful to alleviate some symptoms. A 2021 research study found that out of 612 participants with breast cancer, 42% of them used cannabis within 5 years of their diagnosis. In that same study, the most common reasons for using cannabis reported included relieving pain, insomnia, anxiety, stress, vomiting, and nausea. The unscientific evidence from that study shows that cannabis helped soothe some side effects that accompany typical cancer treatments like chemotherapy. Other research studies suggest that cannabis, or more specifically, cannabidiol, or CBD, may ease cancer or chemotherapy symptoms such as nausea or nerve pain. Studies on animal subjects suggest that cannabis could work to reduce the need for painkillers in subjects with cancer. However, this evidence isn't proof, and more human-based research is needed to support their claims. Another promising outcome of early cannabis research suggests that it may help stunt the growth of some types of breast cancer, though the data is inconclusive. For example, a 2020 scientific article suggested that cannabinoids, chemical compounds found in the cannabis plants, could slow down or even stop the growth of estrogen receptor-positive breast cancer. Despite the promising findings, no clinical trials have been conducted to confirm the efficacy of cannabis in treating breast cancer in human patients. Regarding approved medicinal use of cannabis, the Food and Drug Administration, or FDA, has already approved 2 cannabis-derived medicines to treat some cancer symptoms. Those medicines are nabilone, an oral drug that treats vomiting and nausea, and dronabinol, an oral medicine used for treating vomiting and appetite loss. There's no definitive way to tell how cannabis might interact with each person, so it is best to consult a physician before trying alternative or experimental treatments. Please be sure to like, subscribe, and share.